Your body fights every second to keep blood sugar normal. But do you know which organ actually does most of the work? It's not your pancreas. If you struggle with sugar cravings, fatigue, or diabetes, the real problem might not be the what you think. Let's break it down. Let us talk about blood sugar. It's one of the most misunderstood topic in health. Whether you have diabetes, low blood sugar, or just want to stay healthy, this is something you need to know. Your body has one rule: keep blood sugar stable around 100 milligrams per deciliter. Too high. That is hyperglycemia linked to diabetes. Too low. That is hypoglycemia, dizziness, weakness, and even fainting. And here is the kicker. Even if you don't eat sugar directly, almost everything you eat, carbs, protein, and even fat, can eventually be turned into glucose because your cells need it for energy. The two key organs. So, who control blood sugar? Two organs, the pancreas and the liver. The pancreas steps in when you eat, releasing insulin to pull sugar out of the blood. The liver takes over when you are not eating, releasing stored sugar to keep levels steady. Think of them as dance partner working back and forth, but here is the surprise. Your liver does about 100 times more work than your pancreas. Yet most people only focus on insulin. Stored sugar versus fat. Your body stores sugar in two places, the liver and the muscles. This stored sugar is called glycogen. When glycogen is gone, the body turns to fat for backup energy. That's why fasting or exercise helps burn fat only when sugar stored are low. But here's the twist. Storing sugar properly requires potassium. Without enough potassium, your body struggles to store sugar, making you crave sweets. That is why people with low potassium often crave sugar even more. How much potassium do we need? Around 4700 mg a day. That is equal to about 7 to 10 cups of vegetables. A banana won't cut it. You did need 10. That is why leafy greens like kale, spinach, or salads are so important. What happens with diabetes? Now let's clear up the difference between type 1 and type 2 diabetes. Type 2 diabetes, this is mainly a liver issue. The liver becomes resistant to insulin, almost like ignoring repeated phone calls. Medicine like metformin helps the liver respond better. Type 1 diabetes, this is a pancreas issue. The insulin producing cells are damaged or exhausted, so the body can't make insulin at all. These patients rely on insulin injections. The real cause of type 2. Too much sugar over time. The average person consumes over 140 pounds of sugar per year. way more than the body can handle. Growth hormones and aging. Here is something most people don't realize. Growth hormone plays a huge role in controlling blood sugar. As we age, growth hormone levels drop. Less growth hormone means less liver support, more fat storage, and faster aging. Growth hormone also protect your muscles and collagen, keeping your skin, joints and energy level strong. How do we boost growth hormones naturally? High intensity interval training, hit 7 to 8 hours of sleep, eating plenty of vegetables to heal the liver. Now, healing the liver. Since the liver does most of the blood sugar in regulation, keeping it healthy is key. That means avoiding processed food, sugar and excess alcohol, eating more bitter and leafy vegetables like kale, managing stress to reduce the hormone cortisol, which breaks down muscle into sugar. A healthier liver takes stress off the pancreas and helps balance blood sugar naturally. So if you want to manage your blood sugar, don't just think about insulin or avoiding sugar. Think about getting enough potassium. Eating at least 7 cups of veggies, protecting your liver, sleeping well, and moving your body the right way. Because the truth is, your liver is the hidden key to blood sugar health. If you found this eye-opening, hit like, share it and someone who needs, and subscribe for more science-backed health tips.